Hi, my name is Rochelle Franklin, and I'm going to be performing the prenatal education precautions skills video today. First, I'm going to provide privacy, wash my hands, introduce myself to my patient, and ask for their full name and date of birth to verify I have the right patient. First, we're going to discuss the specific foods that should be avoided during pregnancy and why. So foods that should be avoided during pregnancy is shark, swordfish, king mackerel, and tilefish. These fish are high in a mercury content and can be highly toxic, can cause birth defects, and we should really limit fish to 6 ounces a week. Another food to avoid is artificial sweeteners such as NutraSweet, Equal. They contain aspartame, and it's not recommended for pregnant women, as well as smoked or cured meats such as cold cuts, corned beef, or frozen entree meals, as they have low nutritional value and may contribute to developing hypertension. Other things that we're going to discuss today is over-the-counter medications and supplements. Some over-the-counter medications that are safe for pregnancy are antacids such as Tums, Mylanta, Pepcid, our Sympathiacone, which is a Gas-X, just to relieve some gas pains. Imodium, or even doing the Bratz diet, is a really good way to help with the nausea and vomiting that may occur during pregnancy. Bratz diet is including bananas, rice, applesauce, toast, and tea for diarrhea. And then, of course, we want to do some folic acid, iron, calcium, vitamin D, choline, omega-3 fatty acids, vitamin B and C. Things that we do want to avoid are going to be vitamin A, vitamin E, and then specifically we want to avoid Pepto-Bismol, decongestants, and NSAIDs. Those are not recommended for pregnant women. And then also some environmental exposures to avoid while pregnant. So hazards such as lead, mercury, environmental tobacco, secondhand smoke, as well as some pesticides, solvents containing chloride can lead to, and lead, such as in exhaust, and you can find it in soil and paint. Those are some environmental exposures you want to avoid. And then also for substance use, of course, there is no recommended substance use for a pregnant woman, as many substances can pass through the placenta. So the substance to the pregnant woman will also reach the fetus. This includes tobacco. You're going to have a possible stillbirth, cleft lip, preterm, or a low weight, as well as a couple other complications. Those are the main ones. And then alcohol and drug. You can have a neonatal absence syndrome, and that's going to be a withdrawal that the baby has due to the use from the mother. Some traveling tips and tricks to stay safe. The safety times for a pregnant woman to travel is going to be 14 to 28 weeks. If not any complications, that's okay to travel. Avoid traveling after your 36 weeks domestically, and then it's also advised to not travel 28 to 25 weeks internationally. And things that can cause some complications is the prolonged sitting without getting up and moving around can lead to a deep vein thrombosis, a lot easier, aka forming a blood clot in the body. Also avoid areas where you will see Zika and malaria as well. All right, and then we're going to discuss the best times during pregnancies to visit the dentist. It's okay to visit the dentist at all trimesters. However, the second trimester is the safest in which you can get dental treatments done. And then as well as dental x-rays are considered to be safe during pregnancy, but it is a possibility to cause some harm to the unborn child. So a lead apron is recommended to protect from direct x-ray exposure. During pregnancy, women women are more prone to gum disease due to the change in hormones. The gums can become red and swollen and inflamed, and this is an early stage of periodontal disease. So definitely something that we should be made aware of. Well, thank you so much. Let me know if you have any more questions. Have a wonderful day. Bye-bye.